Okay. Hi, good morning, everybody. Good morning. We're excited to start session 2. My name is Sarah Sutka from the University of Washington and the Fred Hutchinson Cancer Center, and I'm absolutely thrilled to kick off session number 2, where we're going to be really honing in on some very critical supportive care and adjuvant care type strategies to improve the quality of lives of patients as they're going through treatment. But before we get started, I actually have the honor of introducing Mr. Sid Sadler, who's going to give us a patient perspective that's going to sort of set the stage for what we're going to talk about.
Gotcha. Is the green? Okay, gotcha. All right, guys. I have a loud voice, so I'm going to step back just a little bit. My name is Sid Sadler. I was born and raised in Nashville, Tennessee. I'm 33 years old, and I was diagnosed at 32 years of age. As you can see, I had back in December 6th, I believe, of 2023, I had a 10.5 centimeter mass found on my left kidney. I had a left radical nephrectomy done via the Da Vinci robot back in February of 2024. So not even a year ago, which is kind of crazy, honestly. I was diagnosed with stage 2B, grade 2 clear cell renal carcinoma. And after my diagnosis, I have a background in social media and communications. So after my diagnosis, I was trying to figure out ways in which I can leverage that with patient advocacy. And I kind of found 2 avenues to do that. The first being social media. So prior to my surgery, after my diagnosis, I was looking all over the place. I think everybody here knows Google, probably the worst place to find information, honestly. But needless to say, I went on Google, Facebook, podcasts, you name it, I was on it. Social media can harbor, and we all know this, can harbor misinformation, dangerous information. But there is a lot of space in the cancer community to gather on social media. I wouldn't say that company, misery loves company, but it can be extremely beneficial for patients to talk about their experience. I would say Facebook's probably the most active. Depending on the groups, Facebook's probably the most active. And honestly, I always heard the word advocacy, and to me, it seemed a little foreign of a concept before my diagnosis. And when I decided to kind of get into advocacy with the KCA, for instance, I definitely started to find a little bit of a voice on social media. The next thing I kind of looked at, besides social media and kind of the communications aspect, was men's mental health. One thing I noticed when I would go into some of these cancer groups, whether it be on Facebook, Smart Patients, et cetera, most of the people, whether it be caregivers or patients, were women. That's not a bad thing. But I noticed that not a lot of men were speaking about their diagnosis or their patients, or not their patients, their spouses or partners' diagnosis. Why is that? Well, the men that were speaking out about their diagnosis or their partner's diagnosis were rock stars. We have some of them in this room right now. But this can change. It's not something that just changes overnight. A lot of men, when they're younger, are told to, suck it up, kind of just move about, but you can't suck up a cancer diagnosis. That's not possible. If you find out how to, you can let me know. But opening these avenues for men to share their stories and their feelings is extremely valuable, not just for their mental health, but also for their physical health, right? I think you guys would mostly agree with that. So to kind of wrap up, you can make a difference on social media. The avenue does not impact the message. So it doesn't matter where at on social media. And it also doesn't matter if you don't have experience on social media. You can pick up your phone. Everybody, I guarantee, in this room probably has a smartphone. You can pick up your phone and make an impact on social media. And if not, you can make impacts in other ways that aren't social media related. Not every person also wants to tell their story, and that's completely okay too. That's obviously ironic with me saying that. But you can find other avenues to advocate that you don't have to post your face on social media. You don't have to get in front of a camera all the time. I want to thank the KCA and their sponsors for giving me this opportunity to chat. Thanks, guys.